Oh, I was getting ready to say, why is it looking like it ain't no light? No, put me on here. Oh, goodness. Let's see. Uh-oh. Whew. Hello, hello. How is everyone doing? Hope y'all doing wonderful. I'm going to be real with y'all. It took all the motivation and the inspiration. What's this? Hold on. It took all the motivation and the inspiration, all the other Asians for me to do this 1 hour. But I said, you know what? Because I did cancel it. But I said, you know what? I'm going to go ahead and do it. Because, you know, some of y'all might be looking for the information. And I don't want to be that type of person who don't come through. Even though sometimes y'all be rough. My anxiety be like, So we are here. My name is Medina, founder and owner of shopashesayhesay.com, but I'm also a registered nurse. I've been a registered nurse now for almost 11 years. I'm also a advanced care practitioner and an entrepreneur. So I do have a business, shopashesayhesay.com. And thank y'all so much for following me. I will let y'all know ahead of time. When I get to talking, I don't always look down. I'm gonna try to engage and look down so I can, make sure I answer any questions anybody have. But this is still gonna end at 7:05, even though I started late. PBMW. Oh, I'm 28. I've been 28 now for 17 years. That's how old I am. So this live here, y'all, will be posted on YouTube, my YouTube, and it will be posted on not just my YouTube, but it's also going to be posted on Facebook. Usually when I do my lives here on TikTok, I always transfer them over there because I'm monetized on Facebook. And I have my following is very involved with things. And yes, I am Krishan Rock cousin, okay? I had an incident. I ain't got but one tooth like her. So before anybody try to come for me, just know I am living my life like it's golden, living my life like it's golden, living my life like it's golden, living my life like it's golden. You understand what I'm saying? I'm off the goddamn chain. I'm going to tell y'all that now, too. You understand what I'm saying? I'm a funny motherfucker. I'm a funny motherfucker. I'm a humble motherfucker. I'm a personal motherfucker. I'm a lot of motherfuckers. But at the end of the day, right now, I'm going to be a registered nurse, okay? And give y'all, some insights on things to do that I have encountered in my career. So just to give y'all some feedback, I am an ER nurse at heart. Currently, I work in case management. And I work for Transition of Care program. Now, what that program involves is whenever you in the hospital and you get discharged, as registered nurses, we will follow up with you for 4 weeks to touch base to make sure that you have what you need as far as transitioning home, that you have the resources, that you have health education and overall support and making sure you're doing well. And those things that we make sure you have, like let's say the doctor say, they sending you home with home health, but you ain't heard from the doctor because typically, okay, take note of this, people. Typically, when you in the hospital, when you get discharged, you should be hearing from your home health nurse or either PT, occupational therapy, speech, or whatever therapy within 48 hours, okay? And so I do want to tell y'all this. It is very important that if you are in the hospital, that you make sure you get everything that doctor told you, okay? Read your discharge summary. In your discharge summary, typically it's going to have what you were in for. It's probably going to have a few sheets of like the last day or two that shows your vitals, your blood work, stuff like that. And then it'll also have, if you had a procedure, it'll have your surgeon information, like what appointment that is. It'll have your primary care doctor information. It'll have your specialist information, okay? But sometimes there may not be an appointment listed, all right? If that is the case, then you need to be ensured that you reach out to your provider, whether it's a primary care physician, whether it's your specialist or surgeon, to set up that appointment, all right? Don't always go by what they say, because sometimes the doctors and stuff, they'll say, well, we'll get with you to make an appointment. We'll get with you in a couple of weeks to make an appointment. A couple of weeks go by, you ain't heard nothing. Especially if you had a procedure that requires you to have incisions, okay? Because it is very important. Excuse me, y'all. I'm sorry, swallow fast. It's very important that you have those appointments set up. Because if you have an incision, you see what I'm saying? Or let's say you went home with a G-tube, or you went home with some kind of monitor or something like that. You got to make sure, hey, Bruce, hey, everyone, welcome in. You got to make sure that you know how to operate that stuff. You got to make sure that you know what to look for when it comes to an infection. Okay. It is evidence-based practice now that green drainage is no longer considered an infection. All right. However, if you have an incision and you have a fever, you do notice that the swelling is growing. There's redness there, tender to the touch. Okay. It's weeping meaning oozing with something. Those are indications of infections. And if you had a procedure, on your discharge summary, it should have some form of 24-hour, 7-day nurse line, or some form of doctor, whoever the surgeon was. It should have some kind of on-call number there for you to call, so that if there is an infection, they'll be able to address it accordingly. So those are just some things that I wanted to bring about to make sure people are aware of it when they are leaving the hospital and what they need. Okay. Overall, my objective for this is to empower people to speak up. You got to advocate for yourself. You cannot look for other people to advocate for you, because the reality is everybody ain't going through what you're going through. So everybody is not going to understand what you're going through. But you know how you feel. You know that you need assistance, but you got to be your biggest advocator. Okay. And I always tell my members, because I've worked in case management now for over 7 years. And I tell my members all the time, you have to speak up for yourself. You understand what I'm saying? You can't be dependent on everybody else and this, that, and the third and stuff to just fall out in the sky. Not only that, I let my members know I'm not your personal assistant. I'm a registered nurse. That's two different professions. Okay. If you're an older adult, what I do is I encourage you. And that's where this motivation interviewing is going to come in. I encourage you and teach you the skills so that you're able to go to the doctor and ask the appropriate questions to get the answers that you need. Okay. So something that I mentioned when I was advertising this was, when you go to the doctor, do you sometimes feel like you're being rushed? Like soon as they let you back there and you sit down, the doctor come in, hey, such and such, and then they'll roll up the chair all up in your face. Well, tell me what's going on with you. Okay, tell them to take it back. All right, we're still in COVID days. Okay, nicely. Tell them to slide back, and then let them know the situation and what's going on with you. Be honest, because they cannot treat what they don't know. You see, and I'm gonna be honest with you. Sometimes you can tell them and they don't give a damn. But if that's the case, then you need to start looking into requesting to speak with an office manager or something like that, because we should not be treated. We should not be treated unfairly. You understand what I'm saying? Because of the color of our skin or our social economic status or whatever the case may be. We all should be treated fairly. And so what I do with my members, when it comes to the questions that they may have, first and foremost, I probe them and ask them, what is it that you want to get from this experience with your doctor? And then they'll let me know what that is. Okay. When they let me know what that is, then that's when I go into the motivational interviewing technique. Okay, I'll ask them, well, what questions are you asking? A lot of times it's closed-ended. Closed-ended mean, let's say if I asked you, do you like oatmeal? That's a yes or no answer. See? But if I said to you, explain to me why you like oatmeal, that's going to give you a broader answer. You see what I'm saying? I see the difference there. So what I encourage them to do is write down questions. Okay, write down questions. And then when we talk again, that's when we both role play. Okay, and I actually give them those tools to help them ask those same questions, but open-ended. All right. I'm telling y'all now, doctors love for you to talk to them and know what you're talking about. They love it. They love it because a lot of time, most people they'll say they have questions. No. The doctor will say, well, do you have any questions, before they leave? And they'll say no. And the next thing you know, here they come calling me after the appointment. I'm not a doctor. I can only treat the symptoms. I cannot diagnose you. So my first question is going to be, well, why didn't you ask Mr. Jones? Why didn't you ask them the questions when you were there? I just felt like they were being short with me, or I didn't feel comfortable. I didn't really feel like they was really engaging. Okay, so now what we have to do is we have to get you to feel empowered, to not get intimidated by that. Typically, a visit is 30 minutes. That's how it's billed, 30 minutes. But most times, you're not in that office for no 30 minutes. Most times you come in, you have the administrator come in, she want to do the vitals and all that. Then the doctor come in, talk about whatever, then they out. Less than 30 minutes. You pay for that service. You're paying that copay or whatever for that service. So you deserve to get every drop of the 30 minutes that you're allotted for that particular situation, okay? And so what I do with them is, especially with men, because men don't tend to want to go to the doctor to begin with. But then when they're there, a lot of times men are afraid to say they're in pain. They're afraid to really say how they feel. I'm not saying women don't either, but I'm just talking about the men because most men is who I deal with when it comes to this. It's mostly men. And so what I do is I empower them. Patients, for example, if there's a patient who was newly diagnosed with, Parkinson's disease. Okay. First thing I'm going to ask is, explain to me your understanding of Parkinson's disease. I never just go ahead and just start giving out all kinds of information because that's too much. That's overload. That person is not going to grasp that information when it comes like that. I know nurses that do that because they want to hurry up and do this, but me, no, I don't do that. I ask them when they let me know what their diagnosis is. For example, Parkinson's, I ask them, explain to me what Parkinson's disease is. When they explain to me what they know, I congratulate them for that. I say, okay then, honorary doctor. Or if it's a woman or something now, I'm saying, okay, honorary nurse, you better go ahead. The way I am now, y'all, is how I am with my patients, and that's why they love me, because I keeps it real with them. You understand what I'm saying? Not only that, I let them know what my experiences have been. My experience with working with being a patient of doctors have not always been the best. Because I myself have been on Section 8. I myself has had food stamps. I grew up in a low socioeconomic group. I myself had Medicaid. You understand? And they do treat you differently when you got Medicaid, Medicare. I'm just gonna let y'all know that right now. Yes, you do get treated differently. Okay, it is what it is. But what I want to do is empower whomever it is for them to understand the pathophysiology of what their disease is. Meaning, what is it? What is Parkinson's? Okay. And so when the member tells me what they know, I congratulate them for what they know. Cause you want to give praise for that. That's important. That's beautiful when you understand your condition. I love it. And then I ask them, is it okay if I can give you some more information about it that I think will be very helpful to your healing journey? Sure. And see, right then, I'm getting permission. I'm not just saying, well, no, that ain't right. Let me go ahead and tell you what it is. No, you have to move a particular way to get people in healthcare and patients to really trust you. And that's how they will trust you. They will trust you if you would have them explain what's going on with them, congratulate them on them knowing that any milestone that a person goes through, I congratulate them. And then I ask them, can I explain to you, give you some more insight on what Parkinson's is? And then that's when we go from there. And so this is where, and that's pretty much what motivational interviewing is. Motivational interviewing, that's why I say motivational. Motivational interviewing is a style of communication. I'm reading right here off Creditable Resources. I just want y'all to know. That's another thing too. I cannot, honestly and ethically, I can't just give y'all stuff on Google. Information that I'm looking at is related to my employer. So this is Creditable Resources. It's called Understanding Motivational Interviewing. Motivational interviewing is often recommended as an evidence-based approach to behavior change. However, definitions of MI vary widely, including out-of-date, inaccurate understanding. So this particular document that I'm going to be using is just going to give a brief summary of what it is and where to go next if you are interested in learning about this approach. I'm going to tell y'all something. For years now, when motivational interviewing first started, I did not like it. I didn't see any use in it. I felt like it was just some stuff. I really didn't. I didn't like it. But one thing with me is I have to check myself and say, well, how you going to say you don't like nothing if you ain't even trying to use it? You see what I'm saying? That goes for a lot of things in life. If there's things that are new to you, a lot of times when things are new to us, we be so comfortable and set in our ways that we don't want to learn nothing new. We don't want to hear nothing about it, but that could be detrimental to you. And so what I did was, over those years where these employers was offering the motivational interviewing skill classes, I really took a deep dive into it and really invested into it. Welcome, everyone. Thank y'all for coming in. And so with motivational interview, it's a guide, y'all. It's a style of communication that sits between following, good listening, and directing, giving information and advice. Do y'all see what I'm saying? It's a style of communication that sits between following and good listening, because you have people who, when I hate when nurses ask somebody something and then they interrupt them, and that person could be on a break of really opening up to you, really opening up to you, and then you interrupt them, and now you done messed up the whole situation. You have to be able to listen to your patients and what they're saying so that you can be able to assist them accurately and give them accurate evidence-based information. And so I say that to say this. This can be used with your doctor. When your doctor is coming in that room and your doctor talking to you and he like, okay, your bun and creatinine is this. I do show here that your LDL and your HDL is this, and I find, I'm showing here this and this and this, and you just sitting there, You don't know what the hell they talking about. That's your opportunity to say to that doctor that you're paying for that visit and say, Dr. Jones, thank you for this information. Can you explain in layman's term what this means? Can you take a deeper dive in what you just explained to me? Because I really want to understand, doctor. I really want to be compliant. I really want to feel better. And so it's a way that you can communicate. You can't, let me tell y'all something right now. I don't care how pissed, because I had a recent situation that turned out good, but I don't care how pissed you are with a doctor or anyone. No one is going to be receptive to attitude. No one is going to be receptive to you coming with them with the rah-rah. You have to know how to have self-control. and then be able to ask the questions in a professional manner so that you're able to get the answers that you need. You can't come at somebody with the rah-rah, especially when it's coming with your health. They're not going to want to deal with it. And I'm going to tell you, these doctors will quickly cut your ass off. And now here you are calling your insurance. Now you got to find you another doctor. You got to find you another doctor, and you got diabetes, you got high cholesterol, you got COPD, you got other kind of illnesses going on. You can't afford that. So what you have to do is you have to be able to be respectful. You understand? No matter how these doctors are coming to you, I'm not saying you got to take their mess. I'm saying the rah-rah is not going to give you what you want. It's going to get them to call security and exit you on out. That's what it's going to do. Okay? So that's why it's important when you are in the doctor's office and you have questions about anything, even if you can think of something at home and you got questions later, always try to lead with motivational interviewing, open-ended questions. Okay? Not just, well, so you want me to take this? Yes. So I'm not supposed to eat this? No. Explain to me. Y'all see how I keep saying this explain thing? Explain to me, doctor, what diet should I be on with diverticulitis? Explain to me, doctor, what diet should I be on now that I no longer have a gallbladder? You see how I'm doing that? Instead of just, I can't eat spicy foods. No, you can't just do that. You see what I'm saying? You have to take that empowerment and advocate for yourself to get what you need more openly to understand. For example, when you're dealing with your gallbladder, there is so much that goes with that, y'all. There is so much. If you had a bariatric surgery, there is so much that goes with that. Okay? So you want to be able to ask those questions. Diet is very important to those particular things. So something that I do, I always ask my members, explain to me what the surgeon informed you of diverticulitis. Because I want to see what they know. Once I find out what they know, I'm like, oh, that's good. That's wonderful. I'm glad that's some good points. Can I give you a little bit more information? And I never get no. And then we go into the foods. And I asked them, explain to me, what type of foods did the doctor say that you shouldn't be eating because you no longer have a gallbladder? I don't know. I mean, they said something about spicy foods and this and that. Okay, yes, correct. Yep, you should not eat spicy foods. Can I give you some more information about that? Actually, while I'm giving you this information, is it okay that I send you a hard copy so you'll be able to reference it in the future? Sure. Yes, that would be excellent. You see what I'm saying? So even though y'all, I'm off the chain, I take my profession very, very serious. I love people. I love helping people. I love it. And that is why, and I'm so glad that I decided to do this because I did cancel y'all, but then I said, no, I'm gonna go ahead and do this. I got to do this for the people. You understand what I'm saying? I can't let the people down. But this is what the difference is when it comes to, and these same conversations can be with your doctor. It's not necessarily have to be with like a case manager or the nurse or something like that. These same conversations can be with your doctor. When you don't understand it, put their foot to the flame. Ain't nothing wrong with that. Most definitely. And while you're doing it, make sure you have evidence-based information. See, you can't, let me tell you something about some of these practitioners. And the reason why I say some is because not all of them act this way. But some of these doctors have a God complex, and some of them don't like to be challenged. They don't like it. And you know what? I don't care. I'm paying my money for a service for you to treat me. Now, if you no longer want to treat me, that's crime, okay? But at the end of the day, this is what I need from you. And it is okay to tell the doctor, this is what I need from you. You see? But you want to do it in a professional manner. You want to do it in a situation where you're actually, oh, look at this right here. Y'all, this is my first time looking at this right here. Look what this say. MI is designed to empower people to change by drawing out their own meaning, importance, and capacity for change. See, you're no longer going to be that person who's going to always ask closed-ended questions that don't end nowhere. You're going to be that person who's going to change and start asking open-ended questions to get you somewhere. You understand what I'm saying? Well, I'm trying to tell you what I know. What I know is what I'm trying to tell you. And this is what this is. It is based on respectful, curious ways of being with people that facilitates the natural process of change and honors client autonomy. Hey, love, you understand what I'm saying? Everything, I ain't even looked at this. Everything this is saying is what I'm saying. You got to feel empowered and have that autonomy to be able to go into the doctor's office or whoever you're seeing, and feel empowered. You know, don't let someone belittle you. Hey, love, don't let someone talk down to you. Don't let someone make you feel like you don't know what you're talking about and they also affect your dignity. No, don't do that. It is okay. And I always tell my members, especially when it comes to anything that requires you to try to keep a list of things. If you're someone that suffers from high blood pressure, if you're someone who has diabetes, type 1 or type 2, it is very important for you to keep a journal. Keep a journal so that you can see the pattern of what your blood sugars and what your diabetes is, your blood glucose. Keep a journal. But you also want to write down some questions. See, write down some things that you just didn't understand. You understand me? And it is also something that I do is that I ask members, what are some questions? Another open-ended question. What are some questions? What are the top 3 questions that's important to you right now related to your type 2 diabetes that you would like to ask your doctor? That's the homework. If the member appointment is like the day before me to reach them, I'm going to call them that day before and I'm going to ask them, did you write down the 3 questions? What are they? When they tell me what the questions are, if it's great, kudos. You better go on ahead, honorable nurse. Go on ahead. What you trying to take my job? You know what I'm saying? That's how I do. That's just me. I'm just saying. If it's not, I still don't belittle them. I still congratulate them. I still give them praise because they did the homework. They're showing that they want to do better in their health. So I'm like, I'm glad that you came up with them. These are great questions. I would love to give you more insight. Will that be okay? You see what I'm saying? So that's why you have to, when it comes to healthcare, especially these days, because healthcare has changed, y'all. Especially these days, it's important just to be able to feel empowered. That's the overall takeaway from this. Ask the questions. Ask the questions, okay? And then when you ask those questions, if you still feel that you don't have an understanding, it is okay to tell the doctor, I know you done told me this, but explain to me in layman's terms, or explain to me in more detail, what do you mean by this? You see what I'm saying? Because a lot of times when it comes to, and doctors need to be more realistic with people, like with people who have Parkinson's or some of the autoimmune deficiencies and stuff like that, they need to be very honest with people about stuff. And I find that sometimes they're not. You know what I'm saying? But it doesn't mean that it has to leave you in a feeling of you just don't know. Still ask your questions, okay? And also, what's very important as well when it comes to your health and wellness is to ensure that you are letting them know what is your family history. Now, I know sometimes that paperwork gets on your nerves because they got the paternal and the maternal. You got your mother, your cousin, your sister, your brother, this and that. I'm telling y'all what I know. What I know is what I'm trying to tell y'all. Y'all listen to me? Y'all hear me? Take that time and fill that out. You know why? Because that can save your life. Do you know how many people who have been diagnosed early with breast cancer? Because when they wrote those things down, they talked about their great-great-grandmother died of breast cancer. They talked about maybe their father had lung cancer. Maybe a cousin had breast cancer. So automatically what goes off in that doctor's head is, instead of us doing this test at this age, we need to start testing you right now for this right here, because it's showing that you have breast cancer or whatever cancer that runs in the family. So that's going to allow them to do the test that they need to do to ensure that you're healthy. You see what I'm saying? So it's very important to fill out that family history. Okay. And I always say, be truthful and honest with people. If you're someone who is coming up in the, hey, love, how you doing? And welcome in, everyone. I do apologize. When I get on the roll, I don't really look at the comments. But when I get on the roll, I be, doing my thing. But thank y'all so much for coming in. I appreciate it and everything. And I'm glad I decided not to cancel this. I'm so glad. Hey, love, fellows, and you better come on, fellow nurse. Yes, God. You understand what I'm trying to say? So it's definitely important for you to really, empower yourself. I'm not going to hold your hand. You understand? If you call me and tell me you need a primary care doctor, you know what I'm going to tell you? Did you contact customer service? Are you set up online to look up primary care physicians? I'm not a personal assistant. I want you to go ahead. Okay, you ain't do that. Okay, this is what you can do. I'll be more than happy to transfer you to member services, but in the future, that number's on the back of your ID card. All right, any other questions or concerns? It's not? All right, then when you have a great day, and I wish you well in your healing journey. Let me go ahead and transfer you. Boom. You got to do the work. That's right. I'm not going to be sitting here doing some, and some people feel like they are entitled for you to be like an assistant to them. Okay? Allegedly, I had someone leave me a message, and I called them back. This is someone I no longer manage. I'm not even in that department no more. But see, a lot of members in the department that I was in, they still be wanting to talk to me because they love me. And they be telling me, I don't like the case manager I got now, D. You was good. You was this and that. Because see, when I talk to my members, we having a whole good conversation. You understand? Don't let it be the holidays. We you know what I'm saying? What you gonna cook? You sure you know how to cook macaroni and cheese? Come on now. That's how I am with my members. You see what I'm saying? So a lot of them be wanting to call me, but I'm like, I have to tell them and redirect them back to their registered nurse. And then I also let them know, you don't have to keep that case manager. If things are not working right, actually speak to the supervisor. You see what I'm saying? You got to open up your mouth. You got to get what you need to get. Because, the reality is all nurses are not nurturing at heart. All of us are not doing this because we really care about people, if that makes sense. Some of us, they do it for the money. So a lot of people are burnt out. I don't understand why. Because when I get burnt out, I find me another job. You understand what I'm saying? I got to protect my mental. I got to make sure my mental is healthy. Physically I'm healthy, and spiritually I'm healthy. Because I'm going to tell you something. If your mental ain't there, everything else going to fall to the wayside. If your mental ain't there and you're supposed to be taking your diabetes medication, or you're supposed to be going to this doctor, but you're depressed or you down, you ain't doing all that. So we got to focus on the mental. Maslow's law. Look it up. You understand what I'm saying? You got to focus on that to make sure that everything else is going to fall into place. You see what I mean? So when I have those members that I used to have and they ask me questions and things, I do answer it, but I always encourage them to talk to their registered nurse. I'm no longer your case manager. My grandmother said, nurse is a fancy name for homemade. Ooh, girl, I looked at Listen. Boy, oh boy, I'm telling you, because I was a CNA for 7 years before I became a registered nurse. You know what I'm saying? I've been a registered nurse now for almost 11 years, but I've been, I've moved around. You know what I'm saying? But yeah, nursing is not easy. Some people do think that my job, when I have to precept people and the way that I work, they be like, oh my God, you just do this so easy or whatever. I'm just great at what I do. I work smarter, not harder. You understand what I'm saying? I know I'm the shit at what I do. Can't nobody take that away from me. And I'm just saying, this ain't me bragging or none of that. This is confidence. You know what I'm saying? I worked hard to be where I'm at. I work hard to be at the level that I'm at. I used to be in leadership. Leadership ain't for me. It's too much. Now, maybe in the future, I may decide to go back into leadership, but right now, leadership isn't for me. And so that's just something for people that's going through things who are nurses. You don't have to stay somewhere and feel burnt out, especially in the hospital on bedside. You don't have to. There is so much in nursing that you can do. You could do case management. You could do health coach. You could do utilization review. Oh my God, there's so many different positions out there that you can do. You know what I'm saying? You don't have to stay burnt out. You don't have to stay at bedside. But what happens is some nurses get complacent and comfortable in where they are. Well, then if that's the case, then don't complain. You see? Don't complain. I can't stay somewhere and be burnt out. When I'm burnt out, I'm not doing no work. And that's not good for me, and it's not good for the members. They don't deserve that. So I have to look into other opportunities that's going to give me life and help me to help my patients. And this is why I do what I do. This is why I want to do this each week. Hopefully. Because, you know, sometimes, y'all, the way I be feeling sometimes, I be tired. I'm just going to say. Because today was just like short notice, period. But I want to be able to, because this was going to end at 7:05. So that's about 10, 15 minutes. If there's anyone who have any questions as it relates to some challenges that they have actually had when it comes to your doctor, feel free to come on and hit the button to come in. And then I'll be more than happy to do some role play with you and give you some tips that would be helpful. Okay. We got like 15 minutes. I was 15 minutes late. So I'm going to say we got about 20 minutes. Okay. But if it's anyone in the sky, hey, y'all in the sky, come on down. If it's any questions or anything that you have and you might be struggling talking to your doctor, you might feel like your doctor ain't understanding you. Your doctor is treating you a certain way, or you may have questions on other things. I want you all to know, though, I am not a doctor. I cannot diagnose you. All right. I could treat symptoms, but I cannot diagnose you, and I can give you recommendations. All right. I can't treat no symptoms on here, but I'm just saying. But definitely motivational interviewing is a very essential part of what I use to help me out to build that nurse-patient relationship. And it's also what I use when it comes to my own personal situation. Okay. So, cause my doctors are good. I had a little incident, one of my doctors, but we talked it out. It was a misunderstanding and we was able to come, because, even though I was cursing and fussing before I talked to her, I wasn't like that when I talked to her. You see what I mean? So y'all have to be able to, come in a professional way to get what you need, And I also want to tell you guys too, if you have commercial insurance, let me tell you something. You got commercial, Medicaid, Medicare. Okay. If you have commercial insurance, such as Capital Blue Cross Blue Shield, Aetna, United Healthcare, Cigna, Molina, Blue Anthem, any of those kind of things, and there may be some other ones around. Ask them if they have case management services. Just call them up and ask. And then ask them, are you eligible for it? Or if you're a type 2 diabetic or diabetes, ask if they have a diabetic program. If you are with child, you're pregnant, ask them, do they have a maternity? If you're someone who is suffering with cancer, ask them, do they have an oncology case management department? A lot of these employers do not, hear me out. A lot of these employers do not advertise this when they're doing your benefits for the annual year. They don't advertise this. I don't know why. Some of them might be because they don't want to pay that money out when they know they're getting services, but it's in the package. Some of them have it in the package. Okay. So, if you're someone that has a complex or, a lot of health issues and you really need someone in some assistance, please contact your insurance provider and ask them, do you have case management services for long-term care? Typically, long-term care is going to consist of a combined of 3 or more conditions that you have, like somebody who got high blood pressure and high cholesterol and they might have COPD, something like that. But a lot of them do have, y'all listen, I don't work at Aetna, United Healthcare, CVS. Oh, CVS got case management services too. I don't work at all of them, so I know. Okay, I've done utilization review. I have skills working with Milliman, which is used for utilization review, and Intercal, because those are guidelines that are used to determine if you're going to be able to stay in the hospital for this many days, that many days, or if a procedure is going to be approved, those kind of things. Okay. So definitely find that out. And also with Medicare, I worked for 2 different counties in their public health department, and they had case management services. So also that's good to know too. Even if you have Medicare Advantage, call your insurance company and ask them. Medicare Advantage is typically offered through Aetna, United Healthcare, Blue Cross Blue Shield, things like that. Ask them, ask them if you're a senior citizen, ask them, do they give like a little, my mother with United Healthcare, she gets a $300 credit every 3 months. They send her a catalog and she can order whatever she needs, everything over the counter, even blood pressure cuffs, blood glucose stuff, all that. She can order with that $300 credit. And she have a nurse that makes home visits once a month. Now, my employer, we don't do that, but I'm just saying, I've done that before. I've worked in that position in field case management. I've worked in that position before. But those are just giving y'all resources, because a lot of times people just don't know. You know what I'm saying? And some of us also, I do want to take my hat off, and I want to say to those who are caregivers, it is not easy caring for a loved one who is sick. And when I say sick, I'm talking about they got wounds. They got a lot of respiratory things going on. They might have a feeding tube. They might have a PICC line, all these different things going on. And even though they may have a home health nurse come in, that home health nurse is not usually 24 hours, 7 days a week. So my heart goes out to people who are caregivers. And what I would say to you all, look into caregiver support resources. There are groups where that's free, where you can actually be able to communicate with other people that's going through the same thing, because y'all need a break too. You know what I'm saying? You know how many people I've talked to on the phone who's cried to me when I've said, how you doing? How mentally, how are you feeling? And they break down. Because they're like, ain't nobody ever asked me that. I love my husband or I love my wife, but I can't. I'm tired, this and that. I don't know what to do. And then that's when I go into probing and asking questions on things. And then I'm like, okay, well, you know what? I'm going to get with the social worker and we're going to see if we can find some type of personal care assistance that's offered in your program. Now, do keep in mind, your insurance may not cover you for that. However, there may be some that have a plan. There may be other resources out there that would pay. It's just so much as case managers that we can do to help. But always, my heart goes out to y'all as the caregivers. And I know it's some of y'all watching now that's burnt out. I get it. That's burnt out. You're doing it all by yourself. You got kids that live in the same state. They don't come and check on mama and daddy. They don't know what's going on. You got family members that live in the same state, probably down the street. You think they come and try to help you with turns every 2 weeks? Turning every 2 hours or doing this and do that? They probably don't. You understand what I'm saying? Hold on, I can't hardly see. But know it. Am I saying it right, boo? Saying it right. Hey, love. Hey, how you doing? Lord, I can't see worth a doggone, y'all. Don't pick on me. Don't pick on me. Can you hear
Hello,
me?
hello.
Can you hear me?
Yeah, I can hear you so far. How you doing?
I'm doing wonderful. You got a question for me, love?
Hold on. Let me get my earpiece.
Oh, you gonna get your earpiece? Okay, no problem. But yes, but my
Yeah,
heart
hold
goes
on.
out to care. Huh?
I'm coming.
Okay, no, you fine, love. You fine. It's a good day. How are you doing, love? I'm doing wonderful. I'm doing wonderful. I hope everyone is. Yes, God. I'm doing wonderful. And follow me. Well, I don't usually say that, but I'm gonna say it today. Follow me. You got your earpiece now. How you pronounce your name, love?
Okay, I'm with you now. How are you doing?
I'm doing wonderful. How you pronounce your name?
You saw?
How you pronounce your
How you
name?
pronounce your name? Oh, my name?
Yes.
Benoit.
Benoit. Benoit. Okay.
Yeah, Benoit.
Okay.
Or you just call me Ben.
Call you Ben. Okay.
Yeah,
No
Ben.
problem. You have a question
Sure.
for me?
Yeah, I need to let you tell me about the topic again because I just come online and I then see you on live. So I would like to share about the topic before I can say whatever anything.
Okay. Now let me make sure I understand what you're saying. Um, you have a topic you want to discuss and you want to see what my advice is about it, correct?
Mm-hmm.
Okay. Okay. Go right ahead, but Ben, go right ahead, love.
You said what?
Hmm?
What did you say?
I said go ahead.
Yeah, I first tell you that I didn't know the topic that you are talking about here before I get up. So I would like you to enlighten me on what are you talking to. So before I can say or anything, I hope you get me.
Oh, you don't know what the topic is about.
Yeah, that is what I'm trying to say.
Oh, okay. Well,
What is the
I'm a
topic?
registered nurse. Okay. And what I'm doing today is talking about healthcare guidance and health and wellness. And I'm just providing skills for people when it comes to their doctors and their care to be able to get empowered, to be able to discuss any type of concerns they have with their doctors, but also just giving little nuggets here and there when it comes to their health. That's what that is.
Yeah, it's a lovely topic.
Hmm.
Because I'm a kind of person, so I can only know about mine, but other people I can't say whatever anything about other people. But I can always know my mind, and then I know that the topic that you bring out, so I'm interested in it. So that is what I can say.
Oh, okay. Do you have questions and like have you had any challenges with your health?
Not actually.
Oh, good. Good. Okay. That's
Not
good.
actually.
That's good. Well, you could definitely follow me.
So,
What I do, I'm a, I'm gonna be honest. You know what I've done. I'm so proud of myself. And I think your earpiece may be causing an echo, but it's okay. It's okay. But
yeah.
yeah, but and I'm going to speak on something, but if there isn't anything else, I just want to say thank you for coming up and trying to get to clarify. And y'all, this right here is an example. He didn't know what the topic was about, so he wanted to, ask me what it's about. And this is what y'all have to do with your doctors when you don't understand something. You got to ask those questions to get clarity. You see what I'm saying? So I appreciate you, Ben, for coming up because this right here was a prime example of what I was talking about.
Okay.
Mm-hmm.
I get you. I get you.
Mm-hmm.
I get
Well,
you.
Ben, I'm gonna go ahead and let you go ahead and drop in case somebody else want to come up. But again, I thank you so much for coming in and
No, no,
wanting
no
clarity.
problem.
But I will be doing these
You're welcome.
often, okay? So follow me for more. And I also have boutique as well, but I'm not gonna get into that right now. But follow me so you'll be up to date when I come on live. Okay? How does that sound?
No problem. I will inbox you.
Okay, good. Yeah, inbox me. That's fine.
Yeah, I will inbox you. All
Mm-hmm.
right.
All right, Ben. Peace and love to you, love.
Bye.
Peace and love.
Yeah. Yeah.
Mm-hmm. Can you know how to drive by yourself, or you need me to do it? You got it? Okay then. But I want to say this too, y'all. I want to say I hope that this has been very helpful. I do load this up on my YouTube and on Facebook. Okay. You can follow me on YouTube. If you click in my bio, the YouTube symbol is there. This will be uploaded probably tomorrow. And then on Facebook, I also have it there as well too, okay? Because I'm monetized on Facebook and I get a lot of interaction. But I'm gonna tell y'all something right now. Can I tell y'all something right now? Do y'all mind me doing it? Is it okay? Um, I have been through a lot mentally, and I am learning how to set boundaries for myself. And I told my best friend today, I said, you know what? I'm not going to announce when I'm going live because sometimes the thought of going live, even though people are virtual, I have social anxiety. And then sometimes that social anxiety will play mind tricks on me. And then it'll keep me from wanting to go on here and do what I do and help people. So moving forward, I am going to have more topics to discuss, but it's going to be more of I'm just going to come on and discuss them. You see what I'm saying? Because if I plan something and when the time get closer, I notice that I get panicky. And that's what happened with this. I kept debating on whether I should come on or whether I shouldn't come on. And then I was like, no, somebody might need this. So, but I also said, Medina, but you got to look out for yourself. But one thing I said was, I'm not going to let this anxiety control me. I'm going to control it. It's been too many years. Hey, love. Hey, Ansley. It's been too many years that I've let my depression and my anxiety cripple me, debilitate me, play mind games with me, block blessings for me. I'm not doing that no more. So what I learned as a boundary is, okay, Medina, stop putting things like you can only control the present. You can't worry about the past, it's gone, and you can't worry about the future. So do things when you feel like doing it. Because when you do that, that's when I show up my best self. So I say that to say this to people that if you are someone that's struggling with depression, anxiety, or any other any other mental health, learn how to create those boundaries for you, and you do what's best for you. Don't worry about what everybody else think. Don't worry about what everybody else say. I know sometimes it can be hard. Lord knows I do, especially on this TikTok streets. But I have a ball. I had an accident, and I lost a tooth. And now I created my own character. I'm Krishan Raw Auntie. I don't care about that. I'm still the shit. You don't know that? It's getting, I got an appointment tomorrow. You see? But that's what you got to do. You can't worry about what everybody else think about you and all this and that and the third, because you just don't know what other people is going through. Ain't none of your business. Worry about you. So again, if you're someone that's struggling with anxiety or social anxiety or generalized anxiety or clinical depression or anything like that, don't let that control your life. Take your life back. And that's what I have done. And I'm going to tell you how it all kind of went about. And I don't even know if he's watching or somebody in his crew. Omar Watts. I went into that live, y'all, one day because I was feeling, oh my God. And I released. Oh my God. But they came together. Freezer Gang, they came together and helped me. They came together. My brothers and my sisters came together and put their arms around me and supported me and lifted me up. And ever since then, I'm trying to tell you, ain't no stopping me now. God is good. God is good. I'm not going to worry no more about how my business is going to excel, how my business is going to do this or that. I'm not worrying about it because I know when the time is right, God is going to bless me and give me more than I could ever imagine. So that's what I want to say to you all. You know what I'm saying? I do struggle with mental health, but I'm no longer going to let it control me. It can no longer do that. No longer. You understand what I'm saying? And so that's what I want to say to everyone that's listening, anybody listening in the sky. I thank everybody for y'all support. I don't care who you are, a troll, a supporter, a hater, family member, friend, whoever. I love y'all and I thank y'all for y'all support. I really do. And I love what I do as being a nurse. I love it. I love it. I love it. I love it. So I hope that you all, I was able to give some good skills, some nuggets for you all to take away with you and be able to utilize those things. I'm going to give it about another 3 minutes. Maybe I'm going to say about another 5 minutes. If it's anyone who would like to come up, and don't be shy, y'all. This is a safe space. Let me tell you something. Whoever you are, I always say, hey, beautifuls and handsomes. That's what I always say. Don't be afraid. If you're going through something, come talk about it. If you're a caregiver that you are just, oh my God, you're tired and through, you don't know if you're going to make it. Come talk about it. That's what this is for. That's what I want my platform to be for. Okay. This chick, you know what? Utilize social media for you. Utilize it for you. That's what I would say. Okay. All right. Now, with that being said, I'm going to give it about 2 more minutes to see if anybody else want to come up or have any questions or anything like that. And if you don't, that's perfectly fine. That's perfectly fine. But I am going to say that my this live is sponsored by shoppershesaidhesay.com, my boutique. Yes, God, I'm going to go ahead and talk about it because I can. Okay. We had a really good time last night, y'all. Just out of the blue for 1 hour. I said everything is $15, everything except for the 55% off sale. I got 2 sales and I was so ecstatic, y'all, because it's been really slow this year than last year. But I was just so grateful for those who showed up. Even if you didn't purchase anything, I was grateful for those who showed up, those who followed me, those who, showed support, sent me DMs. But I got 2 sales, y'all. I was so happy. And I think Ansley, who was there to help me, and Lady of Suspense, who was there to help me to guide through that. I do have TikTok Shop, but I haven't completely set it up, but I have been able to set up some things. But that was a great time. We did it for like an hour. And so pretty much how it worked was everything was $15, jeans, dresses, shorts, all the new stuff was $15 just for that 1 hour. But if you did 55% off, you didn't get a discount for that. Okay, because those are some really good prices. But and I got sales from all over, from all the categories. So thank you to the ladies, that Gigi and Teresa, for purchasing from me. I appreciate y'all so much. I will be doing that again, but when I do it, y'all, I'm just doing it. So it can happen at any time. Okay, it can happen at any time. But let me tell you something, Ansley. You already know, girl. You was on it. You and Lady of Suspense. Because when you had to go, Lady of Suspense came in, and we was rocking and rolling. Y'all hear me? Somebody said they couldn't put the discount in because what I did was to get the item for $15. I gave you a code only you could use, and so one use. And so I was able to do that, but I was ecstatic. I was so ecstatic. So I'm going to be packing it. I'm going to be packing those up, and I might just do a packing or something like that tomorrow, because I got to send them off tomorrow. I ship on Tuesdays and Thursdays, but I do want to say, yes, she was able to order. I reached out to her as well, but I did see her order go through. She was able to order. I actually gave her an additional discount just for the trouble that she was having, and that's what it's all about. And I'm also looking for brand ambassadors. No one has said anything yet. Y'all, give me a chance, please, y'all. I'm telling you. Ansley could tell you, hey, you see it for yourself. Just give it a try. I'm looking for brand ambassadors of all sizes. And what that is going to include is free merchandise from shoppershesaidhesay.com. in the size that you wear. You'll also get a discount, so you can use that whenever. And then there'll also be some other stipulations when it comes to that. And when my business do scale to where I can provide additional funds, I will, but I'm just being honest. Right now, I just would love for people to just wear my clothing, try it out, do videos for it, to gain more interest and really grow and scale my business. And I know it's going to happen. It's going to happen in God's time, but it's going to happen. You know what I'm saying? So, hey, love. Hey, I'm doing good. I'm doing wonderful. Hope y'all doing wonderful as well, too. But thank y'all so much. I thank God for giving me the strength to be able to come on here and do this, because I wasn't going to do it, y'all. I'm telling you, I was tired. I had a migraine. That's another thing, y'all. I got to get these migraines under control because these things is ruthless. I'm trying to tell you, they are ruthless. You know what I'm saying? But like I said, I will have this live uploaded on my YouTube channel. Please follow me on YouTube. And you go to my bio, you're going to find two things. You're going to find my website that you can go to view, and then you're going to find the little symbol for the YouTube, okay? And I'll be uploading this on there tomorrow so that everybody can look into that. All right. But God is good, y'all. And I hope that, I hope that you all continue to have a wonderful day. If you do find that there's some questions after this, please send me a DM. That's no problem. I'm more than happy to assist. Even if you have questions on YouTube, let me know. I would say give me about 48 hours to answer. And that's because I work full time. Okay. I also have a position that's a whole higher level that I do as well. And I also do classes for advanced care facilitator. And I am going to be doing something to show that because I think it's important for people to know the difference between a living will, a will, power of attorney that's for financial, and power of health proxy as well. Okay. And 5 wishes. So I am going to talk about that too as well. So much I'm going to talk about, y'all. So trust me, when y'all come in here, you will get the information that you need. And I thank y'all so much for being in here because y'all could be anywhere else, but you chose to be in here to get this information. I'm grateful for y'all. I love y'all. I ain't going to cry because I'm easy to cry, but I'm a fool, y'all. Y'all got to check out my page. I cuss up. You understand what I'm saying? I cuss up. Listen, God's been good to me. Yes, he has. You understand what I'm saying? Yes, God. So definitely I'm going to get ready to go. I lasted a little bit longer because I know I started a little bit late. But I thank y'all so much. I really do. I thank y'all so much. And like I said, if you're interested in being a brand ambassador, just send me a DM and let me know, and we'll go over next steps. If you have a business that you would like to advertise for the next time that I actually come on here and discuss important information, send me a DM and let me know. But please don't send me 50-11 DMs because that will get you blocked. Okay, I can read one time. I don't need you sending me 2 and 3 different of the same stuff. You'd be surprised how people be sending too much stuff. That'll get you blocked. That aggravates me. I'm sorry. Okay. But I'm gonna get ready to go, y'all, and go from there because I know there's a lot of stuff going on in these TikTok streets, and I'm trying to go ahead and fix me something to eat so I could be prepared for it and just lay down. But I love y'all. I thank y'all so much. I do. I appreciate y'all so much. Y'all don't understand. I appreciate y'all so much. All right, so I'm gonna get ready to go. But y'all continue to enjoy your day. Remember to smile, clap, dance, celebrate, and don't let nobody steal your joy. You understand me? Don't let nobody steal your joy. All right. Peace and love. Have a wonderful night. Bye. Oh, thank y'all again. Have a wonderful night.